on the table here, the panel, which is led by the Minister and the MEC, and the Mayor. The Minister and the MEC have come to the hospital. I'm sure all of us are aware of the current issue that has happened in the area, the fatal accident that happened with the congregation from Botswana going to the St. Agnes Church. All what has happened we are well aware of. The Minister and the MEC have come here to inspect the process that has to unfold in order to make sure that all what needs to be done is done properly, then ultimately the bodies of the deceased are transported back to Botswana so that they receive the necessary and respectable funerals that are supposed to happen there. So this media briefing, it's the Minister who's going to talk to you and the MAC just to give a reflection about what we will be doing on our part as the South African government and in collaboration with the Botswana authorities. I'm going to hand over to the MEC, Dr. Popila Matuba, just to give some highlights and then ultimately introduce the Minister, and then the Minister will give you his impression and observation that he has made. Thank you.
Thank you very much, Dr. And greetings to all of you journalists who are here. We really appreciate your presence because you are able to report accurately if you do speak to the Minister or us. And that we must appreciate because this is very tragic. If it's not handled with the sensitivity it deserves, we might worsen the pain that the families are going through. So that is why we have indicated from the beginning that we are going to be open, we are going to be transparent, but we will also guide you where we think you are crossing the line in terms of the ethical responsibility, because you will understand the Department of Health differs from other departments because ethics are the ones that drive the profession and the work that we do. This morning, of course, we received the great support from the Minister of Health, whom you all know, just to come and give us the support that, the much needed support that as a province we really need during this difficult time. And of course, we spent the better part of the morning briefing him as to what we have done since day one, I think around 11 o'clock on the Thursday when this tragic accident happened, up to today as to how far are we. We further took him to go and visit our 8-year-old survivor who is in good spirit, who is doing well. And I understand you all would want to have taken a picture with her. I still insist and repeat, in the presence of my principal, our task is to protect the girl child. He would not know the damage that can cause by just allowing one of you to be in, because all of you will need that scoop. And this is a child. You know, sometimes we as politicians, as adults, we get overwhelmed by media. Imagine a child and a mother who were never trained to handle media. So we want them to be focusing on the physical recovery of the child, all the wounds that are there to recover well. We also, most importantly, the mental health of the child and her mother. I've said it before, the mother has lost her own mother. She's also grieving and mourning. And any of you here who have lost a parent like I've done, during that time you want to focus on healing. So let's really protect the mother and the child. And I know some of you are sending us messages that there is this newspaper which has interviewed. As far as we know, no one has been given an opportunity to interview them. At the right time, they will talk to the media. For now, give psychologists the space and the chance. We further, which I thought maybe you will have a stampede to join us, but you didn't come. I was disappointed, Minister, when we go to the mortuary, all of them didn't want to come. They were having a stampede to go to the pit ward, but where we wanted them to come, they didn't come, to show that this matter is very sensitive, it's traumatizing. I'm just giving you an illustration. So Minister has gone and met our staff, our team from Pretoria SAPS, our team from Forensic in the province. The Minister has given them words of encouragement, and for that, we really appreciate. The team will be able to work throughout the whole time and meet deadlines because they have received a message of encouragement. So I don't need to introduce the Minister. I'll just ask him to can address you, Minister.
Well, thank you very much, MSC. Thank you for those words of your own introduction to the matter, and also let me recognize our Honorable Mayor and also our senior officials who are here from the Department of Health, and also we had SAPS earlier on. I'm not sure whether but they're also quite busy here. Well, indeed, let me firstly just express my own condolences to all the families of those who lost their loved ones in this very tragic accident. This is really one of very touching tragedies to happen in our country, more especially when it happens not just to our citizens, but to citizens of another country who were looking forward to spending a very good holy period of Easter at the holy mountain of Moriah at the St. Agnes ZCC. So I want to add my words of condolences to the families and also to our colleagues in the government of Botswana. Later today, I'll give a call also to my colleague there, Dr. Nicoloti, who is the Minister of Health of Botswana, just to give him also a feedback. We're here really to come and give our support to the province of Limpopo. I want to thank the embassy and the team, both from the health and also multidisciplinary team, which have been working on this tragedy. We really appreciate the manner in which immediately what happened to the state. Unfortunately, as we all know, we have one survivor.
She's the first respondent
What is recorded as the
They are the ones who are there, other members.
We appreciate the fact that the team from our forensic pathologists and also from South African Police Service immediately went on the scene and tried to salvage whatever they could salvage. And of course, unfortunately, found that as you know, only one way to survive.
Yeah, thank you.
Very happy with that.
Welcome. You're always here. It's always coming. There's always been assisting.
To see them. And I just want to add on what the MEC have said, that it's not really disrespect to yourselves as the members of the media. You all should imagine, just take it as something which happens in your own family. You would really want to have as much privacy for quite some time until when you feel that you're psychologically ready to can face the public out there. So just ask your own indulgence in that way, just your own understanding that this is the kind of circumstance we're dealing with. Now, again, just to communicate to South Africans to say indeed, and the Botswana people to say, as a government of South Africa working on this matter, we're doing everything possible to make sure that the families of those who have departed as speedily as possible can have an opportunity for closure. Because after a tragedy of this nature, the hardest thing is now, in the circumstances like this, where you know that your loved ones have departed, passed away in a very tragic incident, but you are not able to get closure. And we want to assure everyone to say that the team is really working hard. Dr. Mama Sheila briefed us, and also in the mortuary there, Dr. Matrala and their team, Dr. Storm, and also from SAPS, the general from SAPS who are leading in the victim identification. They are doing everything humanly possible with all the possible technology available to make sure that as speedily as possible they can be able to complete the task in terms of completing the required post-mortems, the required medical legal requirements. But over and above that, the most difficult, of course, is the process of identifying the remains of those who have been died beyond recognition. So as we have been briefed and confirmed also in the mortuary earlier on, that I think the MEC has been updating some of you from Friday onwards. We can confirm that there are 8 bodies which identified, 6 of them. Preliminary identification has already been done. What is left is just for the more intense legal requirement in terms of proper victim identification as required by South African Police Services to be completed in terms of those. The doctors, the pathologists have done the postmortems on those bodies. So those who already been identified and just waiting those final, legally required formal victim identification, those will be ready to can be repatriated once the postmortems, and some of those have already been done this morning, and the others will be completed later today. So as early as tomorrow, once all the procedures, including from our side, we do have colleagues who are here who work with the Border Management Authority and also the South African Police Service. There are particular requirements which are needed legally in terms of human remains. If anybody passes away in our country, for the remains to be taken back to their country, there are particular requirements, including the postmortems, the identifications, and all that, which some of those now have been completed. So we can confirm, therefore, that in terms of those bodies which are identifiable and postmortems are being done, that will be completed. And those families, working together with the government of Botswana, the details of repatriation will be finalized by the end of this week. Those processes should be finalized. The difficult part is in terms of the remains of those who are not identified, and complicated, as you know, by the fact that the bus also caught fire. So that process is going to be very painstaking, and I really want to appeal to the families. Let's start with the families, because they are the ones who are feeling the biggest pressure and biggest pain. That as the government of South Africa, with all the multidisciplinary teams, we will do everything possible in terms of the technology and the expertise of our pathologists, our lots of police service team. Everything will be done to make sure that the process can be completed. But what we need to be straightforward upfront from the experience of previous events.
Thank you. Welcome. You're always here.
always coming. There's always been assisted.
We know that once a death like this is complicated by fire, it just gets very complicated. So, unfortunately, the reality is that in this case, because it's a situation where, firstly, it's trauma, which, splits somebody's, human body, and the pathologists have to work hard to assemble everything, and then complicated by the fire. That process of identification, which the team have started, as we've said, with those where there is complete human bodies, that will be completed. But as they start this other part of the plasma, is, I think, 23 bodies which must still be properly, try everything to organize and do various forms of testing. X-ray tests have already been done. That's just the first part. The more difficult part, of course, is now taking tissue samples, making sure that those tissues can then be subjected to the DNA testing, but also matching the DNA findings with those of possible relatives from those more than 30, just over 33 families. So that process, I know that there will be, intense questions to say, but when is it going to be completed? Unfortunately, all that we can say is that it's going to take time. It's going to take a lot of time. We are not in a position at this stage to comment on the advice of our own experts, both from the police forensics and also from our own health forensic specialists. That all that we can say is we will update over time on a regular basis, possibly at the best maybe we can say on a weekly basis. It should be possible to then give an update as to how far the process is, because even when everybody is under one border as South Africans, it still takes a lot of time. But in this case, because we're talking about relatives who are across in another country where there must be arrangements, samples taken, subjected to testing, matching all those samples and the results of those DNA testing. So I know that you will be disappointed, but we thought we would rather be honest and disappoint you now, rather than be very too optimistic and start giving you timelines to say by this time so many will be completed. All that we can say at this stage is it's going to take some time, it's going to need patience, but we want to assure all the families that everything will be done to bring closer to make sure that the process is completed as quickly as possible. So we're very grateful for the child. As we said, we went to see the child is doing well. Miracle, it's a real miracle that the child survived without any breaking of bones, just minor scratches and wounds which will heal. And as early as tomorrow, the child should be able to go home, and all that will also be done in conjunction with the Botswana Embassy. That's the best happy ending in this very tragic situation. Thank you very much.
Thank you, Minister. Thank you, Minister. What I will do quickly is to get into questions if there are questions, comments.